prone springing. First of all, like with all things, prone, we want to set the table to the patient and the patient to the table. So the first thing I'm going to do is look at that table and say, you know what, I got to set this table back to neutral. I need to stay, and I want to get her centered on the table, and she really is not. So I'm just going to knock her over. Put the ankle rest down by the ankle. Silly. I come back. I like to take a look at where their shoulders are relative to the headpiece, because you can see there are these sharp metal pieces here. Slide down an inch towards your feet. So there's a little space right here. They're not touching. Her arms are on the arm piece. She looks fairly relaxed. But then I'm going to ask her, are you comfortable there?
Yep.
Because I don't want her to be tight as I go to actually motion palpate her or statically palpate her. All right, so in this position, I can do both static and motion palpation. Let's go right to motion palpation. We can start with the SI joints. The first, what we want to do right now is we're just going to do a scan, a motion scan. All right, so I find her iliac crest, her PSISs. I'm going to take a nice soft contact across her ilium, and I'm just going to pump it, right? P to A, I to S, M to L. Does that bother at all?
Nope.
Right upper joint, right lower joint, anything there?
Nope.
The other side, ilium. Notice how I changed my hand. I'm still going through the plane line of the joint here. Notice I shifted my sternum so that I can get a mechanical advantage and slide that ilium there and all. I'm going to pump her sacral base. Anything there? And her apex. Anything down there? No. Notice my fingers are always going up the spine, and they are staying away from hui. Keep your fingers away from hui. This is away from hui. This is towards hui. Away from hui. Okay, so now I'm going to work right up the spine. I'm springing the spine, spinuses one at a time, starting at L5. Tell me if you have any pain or discomfort. And where am I using on my hand? Well, you have options. Anywhere along here that fits is the answer. All right, so I have a hypothenar. Some people come in here with the inner eminence depression or their thenar. I typically use my hypothenar area. I'm coming right up the spine. Anything at all? I'm just going to keep going here. Just springing through her spinuses. Anything there?
Nope.
Notice how I'm changing my sternum and I'm actually coming back a little bit S to I. The plane line of the disc changes. So I'm basically trying to come in perpendicular to the kyphosis. And I'm going to finish her off here at the CT junction. Anything there?
Nope.
And then there's the cervical scan. You did a cervical scan as well, prone? With a reinforced thumb web? Like this?
Nope.
All right. We'll leave that for later then. We'll come back to that. So let's just do this. You're going to put your patient prone, do the SI joints, do the sacrum, 2 contacts, and then spring all the way up to T1. There you go. Up you go. Rotate one more tablecloth.